to the third week of our annual Caregiver Conference. Today we have a good lineup. We have Ms. Anise Norman from Social Security. We have Jill Disney from the Alzheimer'S Association. And we have Daryl Blackwell from the DeKalb County Human Services Office of Aging. Today we will start off with Ms. Anise Norman. Anise is a public affairs specialist. She's a veteran of the United States Air Force who began her career with Social Security as a claims representative in 2001. She is currently a public affairs specialist in the Georgia Area Director's Office. Today, Anise will discuss how to contact Social Security, advanced designation, representative payee, and provide an overall view of my Social Security account. Anise.
Good morning, everyone. And I hope that you can see my screen here. Let me just make this a little bit larger and I'll go ahead and get started. With Social Security, there's going to be a lot of different. There we go. One of the things I want the seniors and everybody to know is that if you have questions about, investing, earning, spending, or protecting your money, a great place to go is called mymoney.gov. And this is where you're going to be able to get some good information that is not biased, because it's not going to be a particular company trying to sell you something. This will come directly from one of those different agencies. Starting on April the 7th, our agency, we did begin to open our doors to allow more members of the public to be able to come into the local Social Security offices, so that if you do have an issue and you need to contact Social Security, I'm going to encourage you to please contact your Social Security office first by calling them and let us see what your issue is, because we may be able to resolve it via the telephone versus you going down to the local office and then waiting in line for some bit of time. But how you're going to contact us is go to our webpage at socialsecurity.gov. On the very first page, scroll to the bottom of the screen, and there's a link there that says contact us. This is going to take you to a second page. On the second page, scroll to the bottom of that screen and hit the option for locate your field office or your servicing office. Once you get there, you should see this screen here. What you need to do is enter your zip code, hit the locate button, and what that will bring up for you will be your local servicing office's address along with their 800 number, so that you can contact them to determine whether or not whatever your issue is, if we need to make an appointment for you, or if you need to come into the local office. And definitely if you need to come in, let us make that appointment for you, so you know you will have a designated time to speak with someone. Now, with our My Social Security account, I want to just encourage everyone that if you don't already have a My Social Security account, please consider making one. How you want to go is, again, from our webpage at socialsecurity.gov, and you want to go / to my account. When you get to my account, this gives you the option to either log into your account, but if you don't have an account, this is where you want to utilize either login.gov or ID me, so that we can verify your identity. And once we verify you are the correct person who is creating this account, then this will allow you to then go to your My Social Security landing page. And some of the things you're going to see from that My Social Security landing page is, first of all, when you hit there, what you would see is your estimated benefit at age 62, your full retirement age, and up to age 70. In addition to that, you'll be able to conduct some business with us. And I just want everybody to know that anybody can help anybody else to create a My Social Security account, but in order, that person does have to have their own email where it says answer some of these out of wallet questions. You don't necessarily have to do that now, because by utilizing ID me and login.gov, that way we will verify that the correct person is indeed creating that account. But some of the things that you can do behind the portal, if you need a replacement Social Security card, you can get that here. You can look to see what your estimated benefit would be and do a lot of what if scenarios. If you've went back to work and if you're somebody receiving Social Security disability, you can load your wages here. If you need a benefit verification letter, maybe you need this for a program for heating assistance, log into your My Social Security account, print out your letter from the benefit, your letter from home, and then you can take it to the organization that is requesting this information. You can also update your address, telephone number, start or change direct deposit. If you need to view letters that you received from Social Security, you can do that here. If you need a replacement Medicare card or a 1099, these are also going to be some of the things that you can see behind the portal. If you filed for retirement, disability, or filed an appeal, you can track the status of your application through the My Social Security account, because now what you'll see is it'll say you're on step 2 of 4, and it'll let you know where you are in the process. And then once the application has been adjudicated to completion, or we finish processing it, then at that point you'd be able to see that final notice there. Just some general information that we do have about Social Security for this year, for 2022, each $1,510 in credits that you earn, that gives you 1 credit. You can earn a maximum of 4 credits per year. And as long as you've grossed at least $6,040 for 2022, then at the end of the year, you would have your 4 quarters of coverage. And the minimum thing that you need to know about qualifying for a retirement benefit is that you need those 40 quarters of coverage, meaning that at some point during your life, you worked for an employer who paid into Social Security for at least 10 years, then you would qualify to be able to receive a Social Security benefit from us. The earliest that you can retire with us is start to receive a benefit is at age 62. And if you do take your benefit at 62, there will be a permanent reduction on the benefit. Here on the screen, I do show what somebody's full retirement age would be, and that's going to be based upon your year of birth. So if you'll find your year of birth, come over to the middle column, and then you would see what your full retirement age is. And what that means is that if you wait until that particular age to come to Social Security to apply for your benefit, you would receive 100% of your benefit. And keep in mind that if you take your benefit early, like at age 62, there will be a reduction on the benefit that is a permanent reduction. And then the only potential increases you would receive would be those COLA or cost of living increases that are determined by the Bureau of Statistics around September, October timeframe. And if inflation does rise to the level that would warrant an increase, then this is going to allow the beneficiaries to receive that increase on their benefit that would be paid in January of the following year. I just want to take a moment here to kind of contrast 2 benefits, especially with a spousal benefit. A spousal benefit is when somebody is drawing a benefit off of their spouse's record, but this is when your spouse is alive, and the most that anyone can receive is up to 50% or up to half of whatever the primary number holder receives at their full retirement age, versus a survivor's benefit. A survivor's benefit, the person has the opportunity to select when to begin that benefit. They can start as early as age 60 to all the way up until their full retirement age. And the amount of the survivor's benefit will depend on at what point you come to Social Security to apply for it. You can receive it as early as age 60, receiving anywhere from 71.5% of the deceased workers or amount, all the way up to 100%. It all depends on when you come and file for the benefit. People always ask, can they work and still receive Social Security? The short answer is yes, you can. And then for this year, for 2022, because I think I have the numbers for 2019, the numbers are going to be $19,560 for the year for under full retirement. And then for the year of full retirement age is reached, it's going to be $51,550, I believe is what is going to be the new amount there that individuals need to be aware of. Now, with the representative payee, This is a program that if an individual who's receiving a Social Security benefit and they're not able to manage their benefits, this allows Social Security to select either an individual or an organization that will assist that person in making sure that their needs are being met, because the benefits would come in this person or organization's name saying blank for blank, and they would receive the benefit in order to make sure that this person's food, clothing, and shelter needs are being met. And we must they must file an application with Social Security, and then we're going to look to see who would be the best representative payee for a person. We're always going to try to start with like a family member, somebody who's going to be able to know about what a person's need is. Another thing that we have at Social Security that is relatively new is called advanced designation. And what this is it allows an individual who is receiving Social Security benefits to go ahead and kind of pre-select up to 3 individuals who, that if something were to happen to them and they were to become incapacitated to the point that they would not be able to manage their own funds, it allows Social Security to contact these individuals to see if they would be interested in becoming the representative payee for this person, and that way to help them to manage their Social Security benefit. And by advanced designating or selecting someone to be your to potentially be your representative payee, it in no way indicates that somebody is not capable of managing their funds. This is just an in case thing. And what's great about the advanced designation, when you are pre-selecting these individuals, if you need to come back to us and say, I changed my mind, I don't want this person anymore, I want somebody else to do it, it's not something that's set in stone. It is very flexible, and all that you would be giving us with regards to advanced designation is going to be that person's name and a way to contact them. And then we would speak to them to determine whether or not they would really be interested in becoming a representative payee for this person. Another thing I want to just remind everybody about is about scam awareness, because there are just so many people out here trying to take advantage of everyone. So it's very important, to the best that you can, to stay on your P's and Q's and understand that Social Security, we're never going to call you demanding money. The most common scam with Social Security is people are either calling, emailing, or texting you saying that your Social Security number is either expired or suspended. That is not true. We do not suspend Social Security numbers, nor do they expire. So if somebody is calling you or texting you or demanding that you must pay an immediate payment in order to reinstate your Social Security number, you can just go ahead and hang up the phone. Do not entertain it. That is not from Social Security. But most importantly, please do not give anybody any of your personal information, because that's what they're trying to get. They're trying to get access to either your financial information or your personal information, such as your date of birth, your Social Security number, so that they can commit identity fraud. And we want to eliminate that as best we can by not engaging with these individuals. And this is going to be kind of the gist of just the updates that I wanted to make sure that everyone is aware of from Social Security. And if you have additional questions, and this information is available, I've already shared this information with Ms. Brenda. So if you need a copy of this presentation, I'll be more than happy to share that with you. And I'll stick around to see if anyone would have any additional questions later. Thank you.
Thank you so much, Anise. That was wonderful. That was a lot of good information. Next up will be Miss Jill Disney. Jill Disney is the Senior Director of Programs and Services for the Georgia chapter of the Alzheimer'S Association, where she leads a team of staff across the state. In this role, she provides leadership and supervision for the development, implementation, and evaluation of programs and services for the general public, individuals with dementia, family members, caregivers, and professionals across the state of Georgia. Jill has worked in the nonprofit sector for more than 20 years and earned her MPA in nonprofit management from Georgia State University. Prior to joining the Alzheimer's Association in 2018, she worked at the American Cancer Society and the American Red Cross. She currently serves on work groups to represent the Alzheimer's Association with Georgia Memory Net and Georgia Alzheimer's and Related Dementia State Plan. Jill is passionate about creating a world without Alzheimer's through advancing research and is committed to educating the public and ensuring access to quality care for everyone until that day. Jill?
Thank you, Brenda. Thank
You're
you for
welcome.
having me as a part of this meeting today. I'm so happy to present to everyone. I have got my clock here because I am passionate about this topic, but I'm trying to stay on point so that I stay within the time limit and allow time for other topics today. So as such, I'm going to briefly touch on a range of topics to just kind of introduce you to Alzheimer's and to the Alzheimer's Association. Talking about the impact of Alzheimer's, risk factors and warning signs, resources, and then how you can become involved in the fight against Alzheimer's. Along the way, we're also going to have a few videos. If, as a matter of housekeeping, you have any trouble hearing the video or my internet is a little shaky, just not type in the chat so that I know that there's an issue and I can slow down there. It's not an in-depth program, but it is meant instead to be an introduction. We have other resources that are available on our website and programs in your local community that I'll tell you about at the end of the presentation that you can get more information and support on these topics. So with that, let's go ahead and get started. And a good place to start with anytime we do this presentation is just kind of level setting and taking a brief look at Alzheimer's and dementia as a topic. So in this section, we're going to touch base on changes associated with normal aging versus potential warning signs of Alzheimer's, the relationship between Alzheimer's and dementia. Some people think that they're the same thing when in fact they're not, and risk factors. So one of the most common myths surrounding Alzheimer's disease today is the belief that it's a part of normal aging. It's not. Instead, Alzheimer's is more than just memory loss. It's a progressive and fatal disease that kills nerve cells and tissue in the brain, affecting an individual's ability to remember, think, plan, and ultimately to function. In this first video, providing technology works for me today, a leading expert in aging will share a little bit about Alzheimer's disease and other memory disorders and explain more about the difference between typical age-related changing and possible warning signs. This is one of our Alzheimer's Association volunteers. His name is Dr. Salloway.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often, and it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
And you may have heard the terms Alzheimer's and dementia used interchangeably. And while they are related, there's an important distinction between the two. So let me see if I'm able to increase the volume on my end here. I'm not sure, we'll give this a try here. So this video explains really the difference in Alzheimer's and dementia and the ways in which they're related.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So as Dr. Snyder explained, a diagnosis of dementia is really kind of incomplete because it's an umbrella term that describes a person's changes in memory, thinking, or behavior. And there are many possible causes of dementia, but 60 to 80% of all dementias are caused by Alzheimer's disease. We are called the Alzheimer's Association, but it's important to note that we're here to provide education and support for all related dementias. So all of those terms under the umbrella, as well as other causes of dementia, we're here to provide research to find out more about those causes and support for the caregivers and individuals that are diagnosed with dementia. Everyone is at risk of developing Alzheimer's disease, and although we don't know the exact cause of Alzheimer's, there are a few known common factors that increase a person's risk of developing disease. In this final video, Dr. Snyder will explain the most common risk factors.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences, that is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So in addition to the main risk factors for the general population, Hispanics, African Americans, and women are at a higher risk of Alzheimer's. Researchers shows that older Hispanics are about 1.5 times as likely as older white Americans to develop Alzheimer's and other dementias, while older African Americans are about twice as likely to develop these diseases as older whites. The reason for these differences isn't well understood right now, but researchers believe that higher rates of vascular disease in these groups may also put them at higher risk for Alzheimer's. Women are more likely to develop the disease. An estimated 3.4 million American women are living with the disease today. And we know that women live longer than men, making them more likely to develop Alzheimer's. However, longevity and lower death rates can only partially explain this difference. So really, research is needed to include all of these populations to understand more about the differences and why they occur. So we're going to take a little quiz, and it's going to be the easiest one because we're going to breeze right through. Since we're not in the room, we can't all participate. The question is Alzheimer's a normal part of the aging process? And of course, that's false. Alzheimer's disease is more than memory loss. It's progressive and fatal disease that kills nerve cells and tissue in the brain, affecting an individual's ability to think, plan, and ultimately function. So let's try another one here. What is the greatest known risk factor for Alzheimer's disease? And you're looking at these thinking they all are, and you're right. And the answer is age, because they all are risk factors, But over the age of 65, the risk of Alzheimer's doubles every 5 years, and 32% of people ages 85 and over are living with Alzheimer's. So let's talk just quickly about some of the warning signs. So we have this list that is meant to be a helpful tool in identifying unusual changes in a person's memory, thinking, or behavior. And it's important to know that this doesn't constitute a diagnosis of Alzheimer's or dementia, but is instead a helpful tool in determining when it's important to talk to one's doctor. And we're not going to delve into each one due to time today, but I do want to hit on each of these. And then you can visit our website, alz.org/10signs to learn more or attend one of our programs. So the 10 warning signs are memory loss that disrupts daily life, challenges in planning or solving problems, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images and spatial relationships, new problems with words in speaking or writing, misplacing things and losing the ability to retrace steps, decreased or poor judgment, withdrawal from work or social activities, and changes in mood and personality. Now, please do note that individuals may experience one or more of these signs in varying degrees, and it's not necessarily a sign that every sign is a need to raise concern. But it is important to, if you notice some of these signs in yourself or someone else, to just talk about it. Talk to the doctor, share this experience, and specifically to pay attention to things that are out of the norm, big changes in an individual. So it is important that we pay attention to what's going on in our own cognitive health and not dismiss any changes in what we may be experiencing as normal. Any change that's unusual for your level of functioning or that of someone around you is cause for concern. So let's hear from another Alzheimer's Association expert in our final video on really why it's important to detect Alzheimer's early.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
And to finish out my presentation today, I want to talk about resources available here in the community. As Brenda mentioned in my introduction, I work with the Georgia chapter of the Alzheimer's Association, and we are a global organization, but we have resources right here in the community. So I wanted to just share a few of the things that we have available. You can access our different programs and services a number of ways. We have a 24/7 helpline that is available with trained care consultants 24 hours a day, every day of the year, 800-272-3900. And you can get access to local resources or Alzheimer's Association programs, or even get direct service through those care consultants over the phone to help you with planning for yourself or a loved one. Our Alzheimer's Association website, alz.org. And then in our communities at alz.org/CRF, which stands for Community Resource Finder. And it's there that you'll find information and dates and ways to join different programs such as caregiver support groups that we have that meet online and in local communities across the state. We have several here in the Atlanta area. We also have early stage programs for individuals that are diagnosed in the early stage of dementia to get education and social support, as well as have some fun together. So we have programs like yoga. We have an art appreciation program, a lot of fun things that folks with their care partner come to be a part of a program together. And then very importantly, we hear often people need more education. So education programs such as the 10 warning signs of Alzheimer's, where we go more in depth to those 10 warning signs, or things that are meant for caregivers like understanding and responding to dementia-related behaviors. All of our programs and services that I've mentioned are available free of service or free of charge, and are offered virtually and in person in the community. And our helpline, that 800 number, and alz.org/CRF are both ways to get involved and connect with us on those things. And I did want to just mention on the call today, I invited her to be a part of this program to meet all of you. We have a program manager who serves the Atlanta area specifically. Her name is Deborah Cotton. And I know that if you have needs here in the Atlanta area for programs or additional support, she's happy to help you. So thank you so much for allowing me to share this information and these resources.
Thank you so much, Jill. That was wonderful. We really enjoyed that. A lot of information. And Deborah Cotton, how are you?
I'm doing well. How are you, Ms. Colbert? Nice to see you.
Okay.
All the faces.
I remember you from ARC.
Yes. So
Yes.
very pleased to see everyone on the call today, and I look forward to working with you. As Jill shared in her presentation at the end, that I am one of the new program managers here with the Alzheimer's Association. So I do look forward to working with the community and with the CAP as well. So thank you for the recognition.
Okay, thank you so much. Next up, we'll have Daryl Blackwell. Daryl Blackwell is Division Manager of the Office of Aging for the DeKalb County Human Services Department. Daryl Blackwell has worked as an aging professional for over 23 years. He has been with DeKalb County government since 2007. He previously worked in Fulton County Office of Aging in technology and program development for seniors. He is from Rochester, Pennsylvania, and has lived in DeKalb County for over 25 years. He has an undergraduate degree in Latin American Studies from Allegheny College and a Master's of Science degree in Health Informatics from Capella University. Mr. Blackwell has worked on various projects on aging, health promotion, and health literacy with local, state, and federal organizations. Mr. Blackwell is married with two teenage sons. Mr. Blackwell?
Okay. Well, first thing, I want to thank everybody, and I want to just give a little recognition out to Brenda Colbert, Cynthia Donnell, Sharon Haley, and Jonquil Harris for the fantastic work that they have done during this pandemic and having these caregiver conferences. I've known Brenda for a long time, and the information that they give out isn't just happenstance. It's very critical and hard-hitting and vital information to the community. So I really want to thank Brenda and the team for the work that they've done. So I'm going to share my screen with everyone. Okay. So we're just going to go through this presentation. Here's just some statistics. The pandemic created a need for food insecurity, unfortunately. So we were able to, through our partners and our main partner, Atlanta Regional Commission, we were able to distribute over 548,113 meals, which was a lot of work, but that was what a community does when we're working together. And you can see we impact a lot of different seniors. Our case managers did great work with the numbers, as you can see. We passed out PPE. We did a lot of visits in our in-home service providers, and we also reached out to our homebound seniors, thinking about them with sending them a lot of cards to give them inspiration. But I'd like to talk about what we do in the Office of Aging. We were formerly known as the Office of Senior Affairs back in 1999. And we changed our name actually in 2017, but we are the community-based aging program provider. So we work with the Land Regional Commission. They are our main funders, and we want to definitely thank them for the work that they have done over the years in supporting seniors and caregivers. And how do you access our services? We are designed to help seniors 60 and plus, with their members and caregivers. We have I&R specialists that answer the phones 8:30 to 5, Monday through Friday, so you can get access to our different services. And then the main line is 770-322-2950, which is our aging information line. And so we have, as I said, a lot of information, and we can connect people to services. And this is basically how our services work. The crux of our services are based on case management, and where we can assess people. We have caregiver support, resources, referrals, care transitions for people leaving the hospital, information referral services, and in-home services, which would entail in-home services, which would entail caregiver support services, but also services around homemaking and personal care and respite. Now, our service delivery, our models that we basically try to follow is a lot of communication, collaboration, and coordination through all of our services that we provide to seniors and caregivers. We also serve a lot of folks that would be in what we would call the sandwich generation, where there's a lot of seniors that are caring not only for a younger child, but also an adult. So they're having a lot of issues, but we have partners that help us, such as ISDD and some other partners, nonprofit partners in the community as well. But as I had stated, our main function is case management. That really is a gateway to our services. Lance Jones is our case management supervisor, and that is based on our core services, our home and community-based services for seniors and caregivers. And what we did under the leadership of Damon Scott back in 2017, we actually brought case management in-house along with the management of our senior centers. And that has really proved to be a great boon in helping our service to be extended to the public in a lot more efficient manner. We also have 4 senior centers I'll talk about here shortly. And there you can get a lot of programs around nutrition and education counseling. The seniors get a nutritious meal. They have arts and crafts, group trips, wellness programs, special events, and a lot of various socialization activities. And our 4 centers, they're actually managed by Gertha Lowe Ward, who is the Senior Center Management Supervisor. Deborah Banks manages our DeKalb Atlanta Senior Center, located in Kirkwood area, 25 Warren Street. And her assistant manager is Mr. Reggie Jackson Rogers. And then I've listed the other managers. Lithonia Senior Center is managed by Hazel Gonzalez and Joseph Lewis. South DeKalb is managed by Zenobia Taylor and Yolanda Norris. And North DeKalb is managed by Tamara Rogier and our new staff, Ms. Patterin W. Intro. And so that's just an overview of our services. And I would like to, definitely thank Ms. Norman and Ms. Disney for what they do with the Social Security Administration and as well as the Alzheimer'S Association. The pandemic, as you can imagine, has created a lot of need. And one thing that all of us are in some way or shape and form are caregivers. And just one quote I just wanted to end with shortly is, caregiving often calls us to lean into love we didn't know possible. And I just want to thank all the seniors out there, all the caregivers, all the agencies for the tireless work that you do, for the hope that you bring, and for the blessings that you give people every day, because sometimes you are the only light that are in the lives of people that really need us, especially during this terrible pandemic. So once again, thank all of you, and I'll be around for any questions. Thank you.
Thank you, Daryl. That was a lot of great information. We need to definitely, before Q&A, allow our Director, Mr. Damon Scott, to say a few words, if he will.
Oh, definitely.
Mr. Scott? Okay.
Hello, Brenda. I'm sorry. What's the question?
Okay. Yes. Would you like to say a few words?
I would just like to say thank you to everybody that's part of today's webinar. Great information presented on Alzheimer's and other related services. And thank you to Darryl for giving an overview on the Office of Aging for the county. And thank Lou Walker and you for your leadership in the social work space to the seniors that we serve.
Thank you very much. And we look forward to having more programs like this again in the future. I would like to thank all of our presenters. Everyone did a wonderful job. And there was a lot of great information. Now we'll go into Q&A. And I think Sharon Haley will, Sharon?
Yes, Brenda.
Do you have any questions for us from the chat for Q&A?
No, we have no questions.
Okay, does anyone have any questions? You could raise your hand. I see Lynn has hand raised. Lynn?
Yes, hi. I would like to ask two questions.
Okay, go ahead.
The first question is for Social Security. And she was saying something to the effect that you can draw on your surviving or living partner on Social Security. And I think she was saying at 50%. And I guess my question is, at what age would you do that with the person that's drawing on the person's Social Security have to be over 62? Do they both have to be over 62? Or how does that work? And then my second question will be directed to either Ms. Disney or Mr. Blackwell. On the community aging, is there support, like if you are a nurse or something and you're caring for a parent who has Alzheimer's or dementia, that you can be paid for that service or reimbursed for that service, or how does that work? Thank you.
Okay. Denise?
Yes, ma'am. Okay, your question that you had with regarding to spousal benefits, how that works is for a spousal benefit. First, the primary number holder, he or she must, number one, file an application to receive benefits, and they have to actually be receiving benefits in order to activate or open up the window for a spousal benefit to be available. And then for the spousal benefit, the spouse can be anywhere from age 62 till their full retirement age. If that spouse is at his or her full retirement age, the most that they could potentially receive is up to half of whatever the primary number holder's benefit is. So say, for example, and I'm just going to use a husband and wife, say if the husband filed for his Social Security benefit at his full retirement age, his full benefit is $1,000 a month. And then he starts to receive that benefit. Then the spouse, the wife, has the opportunity to then come in. If she has limited income, then she can file for a spousal benefit off of his record. If she is at her full retirement age, she's able to receive up to 50% or up to half of his benefit at her full retirement age, which the potential there is up to $500 in that example. But if she takes it early at age 62, then she's only going to receive approximately 30% of whatever half of his benefit is. And the spousal benefit is when the spouse is alive. If the spouse passes away, then we're looking at a survivor's benefit. And I hope that helped to answer your question.
Thank you so very much. It did.
Yes, ma'am. And to your second part of the question in regards to receiving compensation for providing the care for your mother, the answer to that is, yes, there is a program that the Atlanta Regional Commission has that you can basically become almost a personal caregiver, but it would be under the guise of a certified in-home service provider. So if you can place your contact information in the chat, we can connect you up with that information. And you can also call our aging information line at 770-322-2950, and we can connect you with that information.
Thank you so very
Okay.
much. I have the number wrote down, but it was for someone else. Thank you.
Okay, you have Miss Jill Disney. Can you piggyback on that, Jill or Deborah Cotton?
Daryl is answering the same way I would, that the structure, the
Okay.
family caregiving program is the
Mhm.
resource here in Georgia. And he was getting resources for Atlanta, which is perfect for this call. But working through your local area agency on aging is the way to apply and judge and gauge eligibility for that program.
Okay. Thank you. Joe Meyer. You can unmute yourself. Joe Meyer, you have your
Yes.
hand up.
Yes, my
Question?
question is for Darrell Blackwell. I live in Conyers, Rockdale County, and I noticed that your services for aging locations were like Lithonia, Atlanta, and Decatur. Would I be able to utilize that service if I live in the Rockdale County?
Unfortunately, ma'am, you would have to utilize the Rockdale County Senior Services because unfortunately you're out of our jurisdiction. But I'm sure you can find their number online, or if you call our number, we can help you find that number. But that's who you would have to contact to receive services in Rockdale County.
Okay, thank you much.
You're quite welcome.
Okay, Ms. Myers, if you would put your email address in chat, we have a referral packet from ARC that we can email you, and you can look up Rockdale County in there, and you'll be able to find their Office of Aging.
Thank you much.
So just put it in chat, and I'll write it down. Okay.
Okay, thank you.
Mm-hmm. Any more questions? Do we have any in chat by any chance?
Brenda, this is
Oh,
Cynthia.
nothing in
Hello.
chat.
Yes, hello,
Okay.
everyone. I just wanted to remind you to take a look at chat where Sharon has placed a survey that she would like for each of the participants to partake in. And all you need to do is to click on the link and answer the few questions. We would certainly appreciate it. Thank you.
Okay, any more questions? Well, I'm sure there are some questions on people's minds about something. Okay, well,
It looks
if
like
you would-
Joe has another question, or you didn't take your hand down, Joe Myers? Do you have another question? You're on mute.
I think she just still has her hand up.
Okay.
Okay, and someone put office hours in. Is that from? Okay, someone put Ms. Myers, someone put a place in Conyers where you can get that information and a telephone number. They already put it in chat for you.
Okay, I'll look for it. Thank you.
Okay, it's in chat. The number is 770-278-7230.
Okay.
And according to the information, it's senior center, or that's in.
Yeah, I'm familiar with that senior center.
Okay, so in other words, if you call them, you'll be able to get your information.
Okay, thank you, and thank the person.
And they also have a Rockdale County website on that you can get other information from.
Thank you
It's
so
on the
much.
chat.
Appreciate
Mhm.
it.
You're welcome. Okay. Okay, well, if we have no more questions, I would like to thank Jill Disney, Daryl Blackwell, and Anise Norman for a wonderful session today. Those were very good information and should have been very helpful to everyone on here, I'm sure. There were a lot of
You can't talk.
thank yous that were in the chat. Hopefully some of you saw the thank yous from different people saying thank you for all your good information and everything. And so that was mostly what was in chat were the thank yous. People were really grateful for the information. So I guess you guys answered everybody's question and everybody is okay. So we will say goodbye until next week. Now, next week we have another great lineup. We'll have next week we'll have the housing department, DeKalb County Housing Department will be on, and they will let you know what's available as far as senior housing is concerned. And we'll also have DFACS on, and we'll have legal aid. So that will be a great lineup. So you guys may want to join us. So we will see you next week, hopefully. Have a great weekend, everybody.
Okay,
A
thank
great
you.
rest of your week.
Thank you.
Thank you. Okay, you're welcome. Thank you. Bye-bye.
Bye-bye.